So after shoulder arthroscopy, and usually with the shoulder arthroscopy goes rotator cuff repair and sometimes tenodesis of the biceps tendon. You can expect to be in a shoulder sling that comes off the day after surgery. And then right after the shoulder sling comes out, start doing gentle shoulder exercises immediately. So I'm going to show the gentle exercises that you can do immediately and the day after surgery. Pretend you're in a sling. You take the sling off and you want to straighten the elbow and keep it straight for a second and then bend it all the way and hold it bent. And do that again. So those gentle range of motion of the elbow. And that helps decrease the swelling and move the muscles. And then squeeze the hand, open and close, and wrist in circles, both directions. And then you can do the pendulum and Codman's exercise. Those are complicated words, but they're very simple exercises. If you stand up in front of me here, Kyla, and you can lean your body to the side like this, and just pretend you're stirring a small pot. This is the Codman's, and then you swing forward and backward and sideways. And you're letting the shoulder hang with gravity and just doing those small exercises to avoid scar tissue. And you can sit back. So it's important to do those exercises because that motion helps the muscle move, so there's less swelling after surgery, less inflammation, more oxygenation, less pain, and less chances for blood clots forming. Okay, and then we also take aspirin after surgery to help with DVT prophylaxis. If you don't have allergy to aspirin, make sure you take that. And sometimes we use naproxen and Tylenol for pain control. And keep the weight lifted after the shoulder arthroscopy under 5 pounds the first 6 weeks, and then you can start progressing with lifting more weights as tolerated gradually after that. Use the cold therapy to apply over the shoulder surgery area to help decrease the swelling, decrease the pain, and lessen the need for pain medication like narcotics. You can go back to doing light activities with that shoulder. So if you've done your surgery yesterday, today you can start brushing your teeth, washing your face, using your hand and your arm to feed yourself, and for other light activity, as long as the weightlifting in that arm is not exceeding 5 pounds after shoulder arthroscopy. And that's probably applies to 95% of cases where we do shoulder arthroscopy cuff repair. Sometimes, obviously, there's more massive cuff tears or larger repairs that we ask the patients to be still for a longer period of time, but that's uncommon nowadays. Regarding showering and dressing changes, so you'll have bulky dressings over the shoulder. Those can come off 2 days after the surgery. Under the bulky dressings, you're going to have thin, small dressings. They're called steri-strips. They're attached to the skin. Those will cover the small wounds after arthroscopy, and they fall off by themselves, so you don't need to remove them. Make sure you don't apply any oils or creams or anything over the surgical area. That will increase the risk of infection. Try to not to touch the shoulder and keep it clean and dry. You can shower 3 days after the surgery. So after the bulky dressings come off, day 2 after surgery or day 3, and day 2 is fine for that. You can stand and shower. Do not immerse the wound underwater and do not go swimming until it's been a month since your surgery.